Hello everyone, my name is Jasmine Washington Means, and today I will be presenting on my literature assessment titled Hospital to Handcuffs, the Criminalization of Mental Illness in the United States Public Policy. This review explores how deinstitutionalization, race, gender, and police involvement have contributed to the reinstitutionalization and criminalization of individuals with mental illness. And it also highlights the urgent need for policy reform. We must first understand how we got to such a high incidence of those with mental illnesses that are criminalized for such. The mistreatment and the stigmatization of mental illness has persisted for centuries. In the 1960s, mental illness asylums, also known as mental health hospitals, were emptied out due to the high incidence of abuse, neglect, and discrimination. During this time, new medication on the market presented opportunities for those with mental illnesses to live with their families instead of in a facility. Funding was also moved to support community-based efforts, but was poorly managed. It led to inhumane procedure that criminalized those with mental illness without treatment being readily available to them. Over 1.2 million people with serious mental illness are incarcerated in the United States prisons and jails today. And it's often because they are committed for their mental illness and they lack access to treatment. This represents not only a mental health crisis, but also a public policy failure. This literature review is relevant to today as Donald Trump has signed a new executive order that has the potential to worsen this issue, making civil commitment an opportunity for those with substance abuse disorders and homelessness without adequate funding for those with mental illnesses. There are several themes that emerged across literature, one being the deinstitutionalization without resources, the closure of psychiatric hospitals in the mid-20th century shifted the burden of care to community systems. But insignificant funding left many without services, leading to increased homelessness and incarceration. Literature also addressed the intersectionality of race and gender. People of color, specifically Black Americans, mostly men, are criminalized for mental illness at disproportionately higher rates than their white counterparts, while white individuals are more often medicalized, while Black individuals are viewed as deviant or dangerous. The literature also discussed a common theme of police involvement in trauma. Police are often the first responders to mental health crises, but their interventions are frequently traumatic. And these results in criminal records for those simply just needing help for mental health. For my literature review, I conducted a thematic narrative review, and the goal was to synthesize findings across multiple sources to understand the policy issue. There was no original data collected or statistical analysis. The literature included both qualitative and quantitative studies, ranging from historical policy analysis to population data. However, there was a need for intersectionality, trauma-informed research, as well as community-engaged methods that centered the voices of those who were impacted. Current practices perpetuate trauma and marginalization. The literature suggests several key interventions that we could take into account, such as the removal of police from mental health crises. Most are not trained well enough to handle mental health crises. Police are taught to make an arrest and not treat and diagnose mental health. Another would be increased funding for community-based and crisis response services. The misuse of funding had prevented community-based organizations from actually assisting those with mental illness when they are no longer receiving treatments and or possibly manic. Another would be to mandate outpatient treatment as an alternative to incarceration. Oftentimes, those with mental illnesses are arrested and released without treatment options, resulting in being placed back into jail. Another would be addressing the extremely high staff to patient ratio and looking at their needs. And these policies would help prevent further harm. Practices perpetuate trauma and marginalization. The literature suggests several key interventions that we could do to combat this, such as the removal of police from mental health crises. Most are not trained well enough to handle mental health crises. Like, police are taught to make an arrest and not treat and diagnose mental health. Another one is increased funding for community-based and crisis response services. The misuse of funding had prevented community-based organizations from assisting those with mental illness when they are no longer receiving treatments or are even manic. They also suggested mandate outpatient treatment as an alternative to incarceration. Oftentimes, those with mental illnesses are arrested and released without treatment options, resulting in being placed back in jail. We also looked into community treatment and high staff to patient ratios for intensive needs. These policies would help significantly reduce recidivism. Drawing from the literature and its contradictions, my research question is, what ways has the history of deinstitutionalization and underfunded community mental health services led to reinstitutionalization of individuals with serious mental health illnesses in the United States jails and prisons? This question centers on the systematic causes of criminalization and seeks actionable and evidence-based solutions. The literature is clear that the criminalization of mental illness is a public policy failure rooted in historical injustice, systematic underfunding, and structural racism. To move forward, we must reimagine how mental health is treated, such as crime, but as health issue deserving of dignity, support, and care. Thank you so much.